So your patient's heart is not generating a sufficient cardiac output to meet the demands of the body. What could it be? My name is Christina, nurse practitioner. Let's talk about congestive heart failure. There are several types of heart failure, such as right-sided versus left-sided heart failure, or systolic versus diastolic heart failure. But to make it easier for you, just think of it in the sense of the patient's heart is not able to pump a sufficient amount of blood to perfuse vital organs. And some of those patients with heart failure can present with shortness of breath, also known as dyspnea, fatigue, and water retention that will correlate with abnormal sodium levels and result in edema. There are two classifications you have: your acute heart failure, think sudden, and your chronic heart failure, which occurs over time. Just like with any disease process, your body attempts to compensate. However, in the sense of heart failure, your heart can't keep up with the demand, so change begins to occur, what we refer to as ventricular remodeling, which affects the pump action of the heart. Now, what is ventricular remodeling? This is when dilation and hypertrophy of the myocardium occurs. To expand on hypertrophy, think about angiotensin II that is produced by the lungs and catecholamines. That is your epinephrine and your norepinephrine that is activated by your sympathetic nervous system. These two factors of angiotensin II and catecholamines require an increase in oxygen and energy demands by the thickened myocardium, which the myocardium tissue of the heart relies on production of ATP, also known as adenosine triphosphate, which is energy. But when the demand for energy is greater than the supply, contractility of the myocardium is compromised. So some of those risk factors are related to ischemic heart disease, myocardial infarction, and genetic predisposition. Other risk factors include age, hypertension that can occur from increased afterload, obesity, diabetes because of insulin resistance. It causes an increased amount of ATP, which is your energy, that results in decreased contractility and remodeling. And renal failure that occurs from preload, that is overstretching from the myocardium, and excessive alcohol abuse. But as cardiac output is diminished, renal perfusion decreases with the RAS system in full activation mode. The renin-angiotensin system is a cycle that regulates fluid volume, electrolyte balance, and blood pressure, as well as systemic vascular resistance. With that said, red flags would be shortness of breath, referred to as dyspnea, fatigue, and fluid retention. So clinical symptoms would be divided into right-sided and left-sided heart failure. Beginning with right-sided heart failure, it would include the following: hypertension from increased volume or low blood pressure from pump failure. Also jugular venous distension, weight gain, or complete opposite, such as anorexia and nausea, swelling of the hands or edema of lower legs, hepatomegaly from excessive alcohol abuse, as mentioned earlier, as a risk factor, splenomegaly, or abdominal distension. And your left-sided heart failure, the clinical symptoms would consist of things such as hypertension from increased volume or low blood pressure from pump failure. Also tachypnea, shortness of breath from pulmonary congestion that could have crackles in the lungs would be your assessment finding. With left-sided heart failure, think lungs, and right-sided heart failure, think systemic, to keep it straight. So some symptoms of your patient in acute pulmonary edema could present with the following, like severe shortness of breath, nasal flaring, cyanosis of the lips. Maybe they will feel cold and clammy to touch, they're diaphoretic, a frothy sputum, And on auscultation, they may sound like they are wheezing with crackles. And another huge red flag would be restlessness. For the patient with heart failure, you'll want the following: an echocardiogram, which will likely have a decreased ejection fraction, and a BNP, which is known as your brain natriuretic peptide. This lab is used to detect heart failure and looks for a protein that is produced in high amounts in the setting of heart failure, and a comprehensive metabolic panel with a chest x-ray. To classify the stage of heart failure, there are two categories most healthcare providers utilize, which are the American College of Cardiology Foundation, ACCF, or American Heart Association, that uses a ABCD grading criteria. For example, letter A listed as those patients for at high risk for heart failure but without structural heart disease to severe, with letter D is listed as refractory heart failure requiring interventions. And your New York Heart Association uses grading criteria from stage 1 with no limitations of physical activity to stage 4, which is unable to carry on any physical activity. But what is your role in heart failure? You want to, as a nurse, educate your patient on medication regimen and how to manage medications and compliance by understanding the reason for the use of these meds. These meds typically include like digoxin, your beta blockers, your ACE inhibitors, diuretics, and your vasodilators. Also, diet modification with a heart-healthy meal planning program that is low sodium, low fat, and low cholesterol diet. And discussing fluid restrictions is essential. Monitoring weight, especially weight gain. You want to notify the MD of weight gain or swelling or edema noted anywhere on the body, especially if they are discharged home. The patient should be aware to notify their doctor as well. And most importantly, have your patient verbalize feelings on lifestyle modifications such as diet modifications. They may benefit from a nutritional consult or a home health nurse to follow up at home for checkups to make sure they are being compliant with their medications and they are able to answer any questions they may need for follow-up. Thank you so much for watching. Be sure to subscribe for upcoming notifications.